Hi, welcome back to our COVID-19 series. So today's topic is working during COVID-19 outbreak. So this is for the frontliners and essential workers, which means the health workers who are dealing with the outbreak and the other workers who are actually working to make sure the country is running smoothly. And before that, let me just introduce ourselves for those who have not seen our videos. So my name is Farah and this is Shaz. We are both clinical psychologists from Mental Health and WeCare Allied Health Center. There we go. So yes, we're talking about how does it feel to be working during this time and what are the challenges?
Okay, so definitely those essential workers are probably feeling very, very stressed. And more stressed than those who are actually staying at home, I would say, because they would have to actually face other people and be at the risk of actually getting infected with the COVID-19.
Yep.
So it is very, very important for them to actually stay healthy and stay mentally strong, because they are actually doing a lot of very important work for
All of us.
Yeah. And so here we're going to talk about some of the coping strategies that they can do so that they are mentally well and feeling okay, right?
Yeah,
Fit.
so that they can actually function.
Yeah.
So number one obviously is ensure that they have enough rest during working time or shifts or something like that. So I think family members need to help them out in that sense. Yeah. So and then of course sufficient unhealthy food so that they still have the energy to actually fight for all of us, right, Chas?
Yeah. So another thing is about staying in contact with family and friends, because of course at this point they probably would also like to isolate themselves and not really want to be in close contact with some of their family and friends, because they may be afraid also that they may have the COVID-19 and they don't want to infect others.
Yes.
But it doesn't mean, once again, to be feeling lonely. Okay, it is about social distancing, but at the same time being connected with others through technology.
Yep.
Yeah.
So and then avoiding unhelpful coping strategies such as alcohol, drugs, or tobacco. That's not good for you. So basically, I think it's similar to the rest of us, is staying healthy. And I think that's important. But I think one of the things that probably even feel more is actually they have this fear that they may infect other people as well.
Yes,
right?
and that is a very valid.
Yeah, and other people, I think some family and friends also may feel that you may infect me. I don't want to be near you. Or why do you have to do this work?
Oh yeah, a lot of people may say, why do you need to go to work? No need to go to work, just stay at home. But they have a social responsibility to actually go
All
out
of
there
us.
to actually help out, right? Because they're the only ones who actually can do that job.
Yeah.
So we, on the other hand, we have to understand that.
Yeah.
Right?
So we need to help them out in any way possible.
So if, let's say, you are an essential worker, you're one of the frontliners, what you could do for yourself is that if you're facing stressful times with your family members and friends, for example, I think it's okay for you to go to your colleagues instead, to your manager, or to other people who are working with you for social support, and to actually talk about what is going on, about your fears and your difficulties.
Sometimes knowing that another person is feeling the same, which actually help you, because sometimes we think that we're the only ones feeling it, everybody else is stronger. Newsflash, sometimes it's not like that. We are all feeling anxious and scared, so it's okay.
Yeah, it's okay. And if it gets too hard, please consider getting help for yourself, for your mental wellness. And this would mean that if you need our services, we have e-therapy services. Please do not hesitate to call us to set an appointment with us.
Okay, thanks.
Alright, thank you. Bye.